Let's Talk Nursing is brought to you by bjninform.com, a learning platform for bite-sized, evidence-based content that supports all aspects of nursing. I'm Samina Hashimi, editor of BJ Inform, and in each episode I chat with experts about topics across person-centered care, nurse wellbeing, and career development. Together, we'll explore their experiences and discuss practical tips and insights that you can apply to your nursing practice. Hello and welcome to the final My Wellbeing episode of this series of Let's Talk Nursing, the BJ and Inform podcast. Today, I'm joined by Claire Leader, Assistant Professor in the Department of Nursing and Midwifery at Northumbria University. As both a registered adult nurse and midwife, Claire has a keen interest in women's health across the life course and is also the Women's Health and Wellbeing Champion for her department. Claire delivers workshops relating to menopause in the workplace and balancing the demands of full-time work with the completion of her PhD as well as a busy home life. She has first-hand experience of the challenges presented when menopause hits. Thank you so much for joining me today, Claire.
Thank you, Samina. Thank you for having me.
So in this episode, we're talking about the menopause. I'm so excited to be covering this topic today because I'm seeing more and more people talk about the menopause more openly in general media, and I think it's just great to keep this discourse going. And the menopause is especially relevant in the field of nursing because most nurses in the UK are female, or I did do some research into this actually, exactly 89.1% of nurses are female in the UK. According to the NMC in 2022, so that might be slightly inaccurate now.
I think it stays pretty much at that level, doesn't it? Actually, the gender split. So it's not variation year on year, so it's probably right. Yeah.
So it's not too outdated that statistic. Then that's great. Yeah, and most of the women who work as nurses are also in the age group affected by the menopause, so it's a very relevant topic to be discussing. But before we start getting into sort of the effect this has on nurses' work, we should probably lay down the foundation with some definitions. So the menopause isn't just a one-off event, right? It can occur in stages, and these are perimenopause, menopause, and postmenopause. So could you define these stages for us, Claire?
Yeah, absolutely, Samina. So perimenopause is actually the time when most of the significant hormonal change happens. And this is the change leading up to the menopause. This is when women reach the end of their reproductive lives, and all of those reproductive hormones start to deplete as we move into that next transition of our life course, if you like. The perimenopause, it can last anywhere between 4 and 7 years, but the duration does vary greatly from woman to woman. It affects most women between the ages of kind of 45 and 55, but the average age of onset is around 51. And actually, that's probably, from a symptomatic perspective, that's probably the most difficult and challenging time, throughout the menopause. The menopause itself is when the woman stops having periods, she's no longer able to get pregnant, and actually it's defined as the time when there have been no menstrual periods for 12 consecutive months. And again, that can be quite difficult. When you listen to women talking about this, they can say they got to month 11 and they thought, yes, I'm here. And then they have a period and then the clock starts again. So this can actually take a little bit of time to reach that point where you've had 12 solid months without a period. And then postmenopausal women are women who they've had that 12 months and beyond, but those symptoms, they can still last even, up to 4 or 5 years after that last period. Some women actually experience it for even longer. Yet, I've heard women who were in their early 60s saying that they're still having some of these menopausal symptoms. So it is quite a significant length of time in a woman's life.
Yeah, and that sounds extremely frustrating, waiting until month 11 to then get your period and then waiting for another year. And then that's not over as well, because then you actually get the menopause and you have to experience all of those symptoms as
well. Absolutely.
Yeah. And on symptoms then, what are the most common symptoms that women tend to experience during the menopause?
So it's really varied. And again, anybody's experience of the menopause is going to be very individual. There's a whole range of symptoms across all of the body systems. So around 75% of women who go through the menopause are going to experience mild to moderate symptoms. Around 45% of women are going to find these symptoms quite hard to deal with, which is quite a significant number when you think about it. So it's really important to put it into context. The symptoms are a direct result of these fluctuating hormones. Certainly in perimenopause, they're going to be fluctuating, ultimately depleting. So, for example, estrogen plays a huge role in lots of physical but also mental functions. So things like skin health, healthy bones, but also things like mental clarity and enhanced moods, etc. Estrogen's also got an anti-inflammatory function. So when it starts to deplete, we see a range of symptoms, such as the common ones like hot flushes. I think that's probably the one that the majority of people will recognise as being a symptom of menopause, but hot flushes, night sweat. But it also has a direct impact on your cardiovascular health, on osteoporosis, depression. Women get brain fog, memory lapses, and even, they can start thinking that they're getting dementia or Alzheimer's. These can be extremely significant and challenging. So the symptoms of menopause are caused by this inflammation because you've not got as much estrogen to help that anti-inflammatory response. So you start to age faster and your risk of illness is increased. Sometimes you might have heard the term inflammaging. Then progesterone also plays a big part in our reproductive health, in our overall health. And so as that starts to deplete as we go through menopause, this causes other symptoms, water retention and sugar cravings, that fatigue, depression, lack of motivation and drive. That's, it's because of the progesterone. And then even, as testosterone starts to deplete, we don't talk as much about testosterone actually, but for some women, not all, for some women that can really have an impact as that starts to deplete. So, we think about things like weight gain, muscle loss, low libido, but there's lots of other symptoms from periodontal, gum disease, gingivitis, that kind of thing, gastrointestinal symptoms, such as abdominal pain or changing bowel habits, urinary issues, so increased frequency, incontinence in some women, stress incontinence, or just that urgency, that sense of urgency that's there all the time. Obviously, changes in the menstrual cycle patterns, the severity, vaginal dryness, breast pain, itchy skin, this range of symptoms. Insomnia is a big one, irritability, mood swings. So it can be really impactful.
It is crazy how variable the symptoms of the menopause can be because I think, you think of hot flushes and maybe some irritability, but there's such a spectrum. I don't know, have you ever watched the TV show The Change?
I haven't, no, I haven't.
But it's really funny because it opens with her going to the doctor and saying, I think I've got dementia because I'm forgetting everything and I've got all these crazy symptoms that don't work together. And he was like, have you considered the menopause? And it was just so crazy that dementia and the menopause can share the same space.
Some of these workshops that I have been delivering for a few years now, actually, Samina, there's always somebody who says that they have, they thought that they were getting Alzheimer's or dementia and they've considered going to see their GP to get tested for it. And it's only when they're speaking in this kind of forum, they realise that it's only through speaking with other women and going to these things and this awareness raising that they think, oh, thank goodness, I'm not getting dementia. This is part of my menopause. And it can be quite reassuring actually for them.
Yeah, I think that's why it's so great that the discourse is opening up and people are talking more about the menopause because it's not just about removing the taboo, it's also helping people understand a bit more about it, which is
absolutely
great. Yeah. And you mentioned that obviously everyone's experiences of the menopause can vary and symptoms can vary. What kind of factors affect your experience of the menopause? Are there lifestyle factors that affect how you experience this?
Absolutely. I mean, in nursing, we recognise, we talk a lot, don't we, about these social determinants of health. And obviously, they very much do impact your experience of the menopause. So this is, they're going to experience it differently depending on things like race, religion, or other health inequalities, disability. So let's use an example of a woman who is living in deprivation. So this is going to increase her stress levels. She's going to be living at overall probably a more stressful life because she's living in deprivation. Now, we do know that, and this is just on a physiological level. This is not, even getting into the psychological side of things, but that stress is going to increase her cortisol levels. And that cortisol is going to have an impact on the endocrine system, on this hormonal imbalance that's going to exacerbate these symptoms and exacerbate her, how she experiences menopause. So, she might not also have the time or the opportunity to eat well or to exercise. She might have other caring responsibilities at the life stage that women are at through this. They're likely to have teenagers, and that can be, challenging, can't it? They might have older parents as well that they're responsible for. If a woman's living, for example, in an abusive relationship, and menopause is going to have greater impact for a variety of reasons. Women who have to observe maybe specific cultural or religious customs and practice might find it more challenging to manage their menopause. They might not have anybody to talk to about it, if they're living in a very conservative community and these topics are very taboo, that can become, again, quite isolating. If a woman's disabled, you have to think it might take a disabled woman longer to get access to a toilet, so this might increase episodes of incontinence. Just, these are just examples, but obviously when they've got these other health inequalities or other coexisting, comorbidities, then it's going to make this transition, this journey through menopause, even more challenging.
Yeah, I think that's sort of not talked about, of how people's experiences can vary, not just on a sort of biological level of our symptoms are different, but also how all these things that are happening in your life that are continuing to happen, nothing pauses for the menopause, can affect that experience as well.
There's a lot of shame as well about some of these symptoms, isn't there? We don't mind in the nursing profession. We'll talk about things like bowel movements and abdominal pain and urinary frequency and vaginal dryness probably a lot more easily and a lot more readily than perhaps women in the general population. So there is that sense of shame around some of this that I think makes it perhaps more difficult for women, and for that awareness raising. Some of this stuff is still taboo even now. So
Yeah, definitely. And looking at nurses who are going through the menopause more specifically, how does this affect you in the workplace?
I would say the number one factor for nurses is, we're often working in very challenging, high stressful, some high adrenaline areas, and that is going to have an impact. The way that individuals manage that stress is also going to have an impact. These stress levels are going to increase things like anxiety and depression, memory loss, the irritability, insomnia. If we think about insomnia, there's a chicken and egg thing going on there, isn't there? You're tired and fatigued, so you want to go to bed, but you can't sleep. So you become more tired and fatigued. And the more tired you are, the more difficult it is to manage stress. So you might get more anxiety, you might get more depression, and it creates this cycle, this downward spiral of negativity. All of these things kind of leading into one that can culminate in somebody who is actually not really in a fit state to possibly even be at work over time. And it has an impact on nurses at work in terms of their self-confidence, in terms of their sense of their being able to carry out their roles as they previously did. Nursing is a really challenging job, isn't it? We use our intellect, we use our emotional capacity, we use our physical body. It's one of those all-round challenging jobs, and you really need to be on your A game as much as possible. And if you're going through menopause and you're having these symptoms, then ultimately that's steadily going to erode your self-esteem, your sense of who you are, your professional identity. And I don't think that's an exaggeration to say that impact is very real. But then there's also the other symptoms that are maybe not as dramatic, but can really make your life at work quite uncomfortable. So hospitals, for example, if you're working in a hospital, they're really warm places to work. And if you're already suffering with hot flushes and hot sweats and that kind of thing, you're just going to get more uncomfortable. If you're already suffering with urinary frequency, for example, and you can't necessarily take those regular breaks, then that's going to be more uncomfortable. So that has the knock-on effect that you might be less likely to drink and stay hydrated because you don't want to feel that you need to go to the loo. And then that's going to cause things like urinary tract infections. All of these things have a knock-on effect. So yeah, there's a range of ways in which the menopause can impact nurses at work.
Yeah. And if the menopause is affecting a nurse's ability to do her job, what can workplaces do to provide support?
So I think there's lots. And actually, I think thankfully that there is a lot more awareness around menopause, and that has been increasing. As you said at the beginning, we've got to remember we are a female-dominated profession. And many of our most experienced and possibly more senior nurses are at this menopausal age. So it's about making policies that align with equality legislation. So menopause itself obviously isn't a protected characteristic, but age, disability, and sex are all protected characteristics. So there is an obligation for employers to recognise it. And it probably starts with developing a menopause-friendly policy. So understanding what impact it has on all staff. So not just the women who are going through menopause, but everybody who is working with them as well. So it's about educating, raising awareness for all staff, but especially probably for those in line management positions. It's about encouraging support networks, thinking about menopause champions to support policy development around the menopause, ensuring that staff and managers alike are aware of occupational health referral pathways, for example, and thinking about reasonable adjustments that can be made, flexible working hours, uniform provision. They might need a couple more uniforms if they're working in a hospital, for example, making sure they've got access to frequent breaks, access to adequate hydration. They're just some of the things that might be considered. Ultimately, it's about developing a person-centred policy that is focusing on the individual needs of that person in that specific workplace.
Mm-hmm. Yeah, because like you said, everyone's experiences are so variable. You don't want to have a blanket one-size-fits-all approach.
Yeah.
No, that's amazing. So outside of workplace adjustments, what are the solutions or treatments to some of the more disruptive symptoms of the menopause that nurses or really anyone can pursue? How can these symptoms be relieved?
So it's a really good question. And again, it goes back to this individual experience of what the menopause is. The first thing I would say to any individual, any woman who feels that these symptoms, she might be getting these symptoms, is to just maybe start keeping a track of them and start maybe just taking a little bit of a daily diary. What is your mood on a scale of 0 to 10? What has your mood been like today? And recording that and plotting it against where you are in your cycle, but also thinking about other factors. Were you at work that day when your mood was 2 out of 10 compared to your day off when your mood was 7 out of 10? What was happening at work? What kind of stresses is it that's maybe exacerbating some of these symptoms? But absolutely, I mean, this is for anybody's health, for any woman at any point in their life. It's obviously really key that we take care of ourselves, but particularly when our bodies are going through such a change, such a transition period, we really, self-care, taking care of ourselves, it is even more important. So, thinking about what we're consuming, what we're putting into our body, is it helping us or is it hindering us? Is it going to be creating more problems? Is it going to exacerbate some of these symptoms that are starting to become a challenge to manage? And maybe that's something else you might want to record if there are particular foods or alcohol, for example, is a big one that is really going to exacerbate some of these symptoms. And I know that many women might turn to alcohol because that's their way of relaxing, feet up, glass of wine. But ultimately, cumulatively, it's not going to help. It's going to have a negative impact on your health. So really consider how much you're drinking. Can you stop drinking for a while? I know people kind of recoil at that thought in the culture that we live in today, but alcohol is, it's a big one. It's very toxic. And you might find that even just cutting down on your alcohol can make a difference with your symptoms. But, thinking about what are you eating, thinking about the level of exercise you're doing, even if it just means going out for a 15-20 minute walk every day out in nature. We're not talking about doing the massive changes. You have to take things step by step, little by little. And that might just start with a 10-minute walk every day, just committed to that until you start, you might start noticing the difference and feeling better. You might start feeling healthier. But exercise is really important. It releases lots of lovely good hormones that can make us feel better and enhance our moods. Also, it helps the body to heal. So lots of benefits, including weight loss. That's another thing that we really need to think about. What's our weight doing? Are we carrying a bit of extra weight? What's our BMI? Is it within a healthy range? But, ultimately, it's a composite approach when we're thinking about managing symptoms of menopause. And that includes very much, we have a responsibility to take care of ourselves in terms of diet and lifestyle, but also there are pharmacological approaches that we can use. So I'm thinking about hormone replacement therapy, or HRT. Now, it's certainly not panacea, but we have to think that the reason that we're having these symptoms is because these hormones are reducing. So if we can replace those hormones in a safe way, then that is going to help. And some women may make the decision to go on HRT or to have a conversation with their GP about it. It can be a game changer for a lot of women who are going through menopause. Particularly, it seems to be that the earlier in the perimenopause, then the more it helps with alleviation of some of these symptoms. And they come in a variety of forms. They can come in tablet form, pills, patches, a combination of a patch and maybe, coil, for example. The type that you have will depend on your individual circumstances and your preferences, and it's about having that conversation as well with your GP. It'll also depend on whether you still have your uterus, for example. If you've had a hysterectomy, then your options are slightly different to if you still have your uterus, because you can't have estrogen only HRT, for example, if you still have your uterus, because that we know that can lead to endometrial cancer. But it's about going and doing your research, looking for really good sources of information around HRT. There's lots out there. You have to be quite discerning in where you go to find that information, but there is good sources of information there. And go fully equipped, ready to have that discussion with your GP. And find a GP in your practice who is quite knowledgeable about the menopause and is quite receptive to these conversations. So, for example, you hear stories of women who are going through this and they're feeling very depressed or they're feeling very anxious, and their GPs put them on antidepressants or on anti-anxiety medications, and it doesn't help. And that's because they're trying to address the symptom, when actually HRT would probably help alleviate those symptoms, because that's the cause of those symptoms. So if you go to a GP who understands that and who has an awareness of the types of HRT and the conversation, that shared decision-making conversation that needs to take place, then you're already, you're pushing on an open door, aren't you? I think GPs are definitely getting better, but there is still a sense out there that there is a little bit of reluctance maybe around prescribing HRT for some women. And it's not completely without risk, but actually for the majority of women, HRT is a really good option. And again, it's about the way that we can maximise the uptake, and the way HRT works is also to take care of our diet and lifestyle and everything else as well. So it has to be that holistic, that composite approach.
Mm-hmm. A combination of sort of lifestyle factors and also maybe pharmacological approaches, and I guess at the end of the day just what your personal preferences are and what you need in that situation. And in your personal experiences with the menopause, were there any times where you felt like your symptoms were just really overwhelming or significantly affected your quality of life? And if so, how did you deal with this?
Yeah, I had a few experiences actually. Meetings are something that always come to mind because you feel a little bit more scrutinised perhaps at meetings, and I was certainly getting that kind of anxiety. But if I was speaking at meetings, I could feel myself flushing, for example, and then because I could feel myself flushing, then you start to blush more and you start to become more anxious, don't you? Needing to go to the loo in the middle of meetings can be quite embarrassing, can't it? You know, why can't you sit through an hour's meeting without needing to go to the toilet? But I think the biggest impact that it had was at home, was my personal relationships, and I could feel it was my irritability, particularly at certain parts of the month, and it was getting to a point where I didn't feel in control sometimes, and that was quite scary. And it was, occasionally I'd take it out on my husband quite inappropriately, actually. And I thought, this isn't on now. I need to do something about it. And I am relatively healthy. I do have, a healthy lifestyle. So I went and I had the conversation with my GP, and I started on HRT patches. And I have to say, I noticed a difference within a couple of months. I felt much better.
Thank you for sharing that. It does sound very difficult, but it's amazing that you're able to get through it with, having this conversation and getting your HRT patches, and that there was kind of a solution.
Absolutely. And my GP was excellent, I have to say. I got a good
Mm.
GP. I got somebody who knew what she was talking about. And there was a few weeks that we were meeting, and she gave me lots of sources to go and read around it and things. So, yeah, I was really lucky.
That's amazing, yeah. So I think a lot of people feel like, the menopause is something that half of the world experiences. So you think you know about it, but then I'm constantly amazed by how much I don't know, and how much happens to people that I've just never associated with having the menopause. And
It,
how
it
scary that must be when you're experiencing it yourself and you feel like you don't know what's happening.
Absolutely. I mean, there's been lots of research actually done around it. And specifically, again, in the workplace, the statistics show that women, they're not going for promotions because of these menopausal symptoms. Some women are resigning their posts because they're going through menopausal symptoms and they're finding it hard to manage them. So they're just leaving their jobs altogether. Well, we can't afford that in nursing. We can't afford to lose more people. We need to make workplaces more conducive to continuing work and supporting nurses, women through this process.
Yeah. So you mentioned before this recording that you've conducted some research around women's experiences of the menopause, and that some of the accounts from nurses were quite startling. Is there a particular case that stuck with you?
There is. Actually, my research wasn't specifically about the menopause. My
Mm.
research was about overall well-being.
Mhm.
And I was really interested in the experiences of nursing and midwifery leaders specifically. But what I found was that, some of the nurses in some of these higher level jobs were also having to battle with some of the symptoms of menopause as well. Obviously, this came into the discussions. And one story in particular really stuck out. So she was a participant who'd been working as a chief nurse in a large acute trust. And it was a very toxic environment that she was in. And she'd been working there for, I think, about 3 years, in this kind of quite toxic environment. And she'd also started to experience menopausal symptoms. Specifically, she talked about increased anxiety, and this manifested in a burning sensation in her chest that she felt, just like there constantly when she was at work. But she talked about, lots of fatigue and tiredness, insomnia, those kinds of symptoms. It's starting to impact her sense of being able to do her job effectively. So she's spoken to the GP about possibly having some HRT, and she was due to have another appointment. She was scheduled another appointment to go and have it prescribed and look at options. And in between the first and the second consultation, she was let go from the role that she was in. And actually, it was a relief for her. And she said within 2 weeks, her symptoms had almost completely alleviated. And I think what it really highlighted was this. negative impact of stress and its potential for exacerbating these symptoms. So you can say a lot of these symptoms might have been due to stress, but also the symptoms would have been worse because of that fluctuation in hormones we're talking about. So yeah, I thought it was quite a stark example actually of the environments and the cultures that some nurses are working in, and some of us have, extremely pressurized jobs, don't we? No matter, which area of nursing you're in, it's such an important job. And actually we mustn't underestimate the impact that working in these environments can have on individual health.
Yeah. No, it's like you mentioned, if in your personal life you have an increased level of stress and your cortisol is high all the time, that's going to exacerbate the symptoms. And nursing is an inherently stressful job. I mean, this example in particular sounds really stressful and really tough, even outside of the whole having menopausal symptoms. So, but yeah, no, I mean, no one wants to get let go, but it's nice that at least in this situation it was sort
It
of
was
had that good
welcomed. It
outcome.
was.
Yeah. Well, now I think we can move on to your 3 key actions. So these are 3 practical actions that you would recommend nurses to implement into their practice or their lives. And this can include nurses who are going through the menopause or, colleagues or anyone who would benefit from this knowledge, really. So what is the first key action that you would recommend?
So, yeah, when I was thinking about the 3 actions, I was thinking about it from number 1, from an individual perspective, number 2, from colleagues, and number 3, from an organisation perspective. So I think, as I've probably already said, it's the importance of taking care of yourself, thinking about the lifestyle changes to relieve the symptoms, thinking about what your symptoms are, when they're worse, what makes them better, that kind of thing. But also it's about seeking help and seeking support. When you look at the current generation, it's Generation X at the minute, isn't it? Pretty tough bunch. We're not really that good at asking for help and reaching out. We just get on with things, and that can be a real disadvantage, So it's about just asking for help, just seeking support. You don't have to go through this alone. There is help and support. So yeah, taking care of yourself, but also asking for help. From the perspective of colleagues, it's understanding that your colleagues who are going through menopause, they might not always function at 100%. There'll be days when they are, absolutely, but there'll be days when they're having off days, and maybe be considerate of that, providing support. Obviously, it goes without saying, don't be patronising about this, but just recognising that, maybe today is not the best day for them to do that particular work on that particular project or do that particular task. So can we consider working in a different area, for example, something like that. So just pulling together as a team. And then from an organisation perspective, having good policies around the menopause, creating training opportunities, making sure that line managers are equipped to be able to refer, to be able to support people through this transition.
Yeah, no, thanks so much for sharing those insights and for highlighting actions that everyone can take, not just putting the onus on the nurse who's experiencing the menopause.
Absolutely.
Mm. So now to wrap up the episode, we're going to go through a couple of scenario-based reflective questions. So I'm going to read out 2 scenarios involving a nurse who's going through the menopause, and Claire will then discuss how she would approach these situations. For our listeners, you can pause the episode once I've read out the scenarios and think about what you would do in these situations, then press play to hear Claire's recommendations. So the first scenario is: you are a nurse who has suddenly begun feeling high levels of anxiety, which is stopping you from effectively advocating for your patients and participating in meetings at work. You think the anxiety may be menopause related, but aren't certain about this. You've been trying to cope on your own, but the anxiety has reached a point where you get extremely stressed at the thought of even going into work. How would you go about seeking support and getting some adjustments made in your workplace? So, Claire, if this was you, how would you go about this?
So I think, first of all, I would start out by thinking, about recognising, is this the menopause? Is this something that is new to you? Is there another reason that you might not be wanting to go to work that you're stressed and anxious about. And that's not to say that it might not be a combination of the two things. So again, it's going back to thinking about the symptoms that you're having at what point in your life, and maybe tracking that. Thinking about, again, we're back to diet and lifestyle, any changes that you can make to try and increase your well-being, to see if that makes a difference to your state of mind and your motivation, making sure that you get enough sleep, for example. And I would certainly be wanting to meet with my manager to talk about the symptoms and to discuss where I'm at, what it is that's going on, how I feel about it, what the symptoms are, what might be creating this sense of not wanting to come into work. And actually thinking as well, before you go into that meeting with your manager, some suggestions for some possible, not solutions, but maybe some adjustments that could be made to make your life a bit easier. So would it be easier if there's a possibility, and I completely acknowledge that in nursing this isn't always available, but can we start a little bit later and finish a bit later, if that's something that you think is going to help? So yeah, maybe a change in shift patterns, that kind of thing. Maybe being asked as well to be referred to occupational health, because they might be able to offer some suggestions around reasonable adjustments that might also be helpful. And then if you find that you're getting nowhere, I would say consider speaking to your union representative. The unions are very hot on this as well. And there is more than likely going to be a union representative in your organisation who knows a bit about menopause policy and what can perhaps be done to support you. And they can go into those meetings with you. Not every organisation is actually where it should be in terms of some of these policies. So, for some nurses, it's going to be a lot easier than for others.
Yeah, no, thanks so much for sharing those insights. The second scenario is you are a ward manager and have realised that one of your team members has suddenly become very irritable and can have angry outbursts without explanation. The team member is a 52-year-old woman and has been complaining of other symptoms such as brain fog, palpitations, and difficulty sleeping that lead you to believe that this is menopause related. You want to approach this team member about her sudden mood changes, but how would you go about having this conversation? So, obviously, a very difficult situation to navigate. Claire, what do you think?
Yeah, so these conversations can be really challenging, can't they? I think number one is going into this with kindness and compassion, with the intention of listening to the team member, because they're 52. It sounds like they're having menopausal symptoms. They might not recognise it in themselves as yet. They might not attribute it to menopause. So you going in and kind of saying, right, well, I think you're in menopause, and what can we do to fix it? Maybe isn't going to go down too well. So I think it's going into a meeting with her with the intention of trying to understand what is going on. And then, over the course of a couple of meetings, if needed, that might be needed until she feels that she can disclose that she thinks she might be going through menopause, or to recognise it, but just take it slowly and gently. Obviously, you have to make it clear that angry outbursts, they're not appropriate, they're not in line with, that professional values that are expected. But there are ways to do that, isn't there? As a manager, we can approach these things and in a way that's not going to destroy the relationship, that's going to create psychological safety. If it's done well, you might be asking questions like, is everything okay with you? Because actually, I've noticed on a couple of occasions that you've been a bit short, or you've seemed angry with colleagues. Is there anything that you want to talk about? And then just about actually what is that individual woman's needs. It's that individualized approach, it's that person-centered approach, and it's as relevant for management as it is for patient care. It's just shutting up and listening and seeking to understand what the issues are and what possible solutions might be, because the solutions will be as individual as the symptoms. I think one good kind of technique as well is, and for any manager listening, I'm not telling my granny to suck eggs here. This is, it's just how I would approach it, but don't be afraid of silence. That shutting up can be really difficult if the person in front of you isn't immediately forthcoming with discussion and information. So just being quiet and not being afraid of that silence, and just creating that space where actually they might feel compelled to fill it. And if they don't want to talk on that occasion, make it known that you're there as a point of contact and, you're there to support her.
Mm-hmm. No, amazing. Yeah, thank you so much for sharing your thoughts on these situations. I feel like many people, including myself, would find these sorts of conversations really difficult to navigate.
Yeah,
So,
of course.
it's really helpful to hear a professional's take on it and get that advice. So yeah, thank you so much. And that essentially brings this episode to an end. Thank you so much for joining me today, Claire. It's been such a pleasure talking to you.
No, thank you. Likewise. And I hope the listeners, even if they just take away, one or two things from it that will help them or one of their colleagues or somebody that they line manage, then it's been useful, hasn't it?
No, and you've dropped so many amazing nuggets of wisdom. So I'm sure there's so many things that people can take away. But thank you so much.
Thank you, Samina.
If you enjoyed this episode of Let's Talk Nursing, do follow us for new episodes and share with your colleagues. For more resources and past episodes, visit bjninform.com. Thank you so much for listening and see you next time.